Okay, so something a little bit different. People often say to me, can I see a before and after picture? So with the help of technology, what I'm going to do is introduce you to Margie. And this is a patient who has come to see us with probably one of the worst acne cases that I've ever seen since I opened any of our clinics. What we're going to try and do to you, the consumer, is show you Margie, get her to give you her input on how she feels, how her skin looks. The treatments that we're going to provide are, first of all, the SkinScription range, and she's been on those products for around just under a week now. She commenced her treatment with some skin analysis. She's in today for basically a review, and that will then follow with a series of chemical peels and some laser treatment. I expect the whole treatment with, all in all, can take anything up to 6 months. Again, it depends on how the client responds. And today I've got Margie here where I know we're going to ask her a couple of questions, yeah? So, first thing that I would ask you is, how long have you suffered from acne?
Since I was a teenager, probably since I was about 14, yeah. And I'm now 34. So, what's that, 20 years?
Yeah.
So, and it's still, I mean, although the outbreaks are less and less, I've still been left with some really bad scarring and still have really bad outbreaks now, which is why I'm going to finally get sorted out.
Okay. And if I would say to you, have you ever tried any other treatments before? Skincare, for example?
I've tried all of the skincare you get on the market, such as Clearasil and all of the ones that you can buy just over the counter, which haven't really helped me. In fact, some probably even made it worse. I've had the general antibiotics from the doctors, which also didn't really do much. I did use Roaccutane in my early 20s, which did help, but obviously that's really harsh and it's not something you can sustain for a long period, and I didn't want to have to go back down that road again. So this is why I'm now trying.
You're here. Okay, so basically you've been using SkinScription, I would say, just under a week, yeah? How have you found your skin?
Absolutely brilliant. I mean, when I came to you last week, I had really bad active spots. I had one massive one, which was horrendous. Yeah. And if you look, although I've got makeup on now, even when I have no makeup on, it honestly looks loads better. The skin's quite a lot drier, which is what I needed at the time, which I was. So, all I'd say is basically, in less than a week, the skin has improved, I'd say 60% from what I was using before, and nothing's ever worked like that has. So I'm really made up.
Fab. And I mean, it does look good today. Yeah. With regards to acne clients, I often find that people think that they need to dry everything up. Yeah. That's often not the case, yeah, because obviously if you take oil away, your body then produces more oil. So all I basically do with acne clients is I look at it from a broad spectrum. So obviously I've got you on an antibiotic, yeah, that's from the States. And what that is doing is treating you systemically, and how the antibiotic works, it actually stops the pore from producing sebum, yeah? The other thing that we're also going to do is I'm going to exfoliate. That's going to be by microdermabrasion, some of our own chemical peels, yeah? And also by the use of a fractional CO2 laser. And what I need you to do is I need you to be extremely honest, yeah? I know that this is going to be on our blog, realreinvention.com. Margie's going to give us her feedback, so you know what, when she wakes up in the morning, she has a spot, or it's disappeared, you're going to tell us how you feel. And if you can, to do that twice a week, that would be brilliant. If you give me the camera, I will show you. This is a very, very, very severe form of acne, yeah, type 4. I mean, all over, some very, very, very heavy scarring. And if anything, a real good challenge for me, yeah, and Wendy as well, yeah. So again, you've got Wendy, who is going to be overseeing the treatment. You've got myself, who is going to be completing all of your treatments, yeah. And we'll go from there. So I think your treatment begins next week. You'll always have this small video camera in front of you. And all I can say is, I want honesty, I want truth, yeah. And I want you to let the consumer know exactly what I do, now you feel.
Of course, will do.
So today we've got Margie in for her first fractional CO2 treatment. You can see that we've prepared the face. She's been using a systemic antibiotic and also she has been using Skinscription. She's had a chemical peel so far, and today it's her first of laser treatments. We've anaesthetised the area. We're going to ensure that the area is cooled, and then we'll show you how we fractionate this. Just bring it over to me. So, first of all, I'm going to set the thank you. First of all, we're going to set the fractional CO2 laser. We're going to use the power of between 27 and 30 watts, and we're going to stack it by 2 to 3 shots. The patient at the moment is anaesthetised, so she will not be able to feel what we are going to do, and we're also going to cool it. Okay. So Wendy, what I want you to do is come onto the face for us. I just want you to video his face. Okay, well, tell me if you can feel anything, Marvin.
No. Oh, very slightly. Very slightly.
And you can see as we move round here, is that cold? You okay?
Yeah.
You'll be able to see very closely that this laser is not what we call a spot laser, but made with tiny, tiny, tiny spot areas. You'll be able to feel this slightly at the side, okay? Maybe stop that, Wendy. Right. At all times, we're cooling the area in order to keep the skin very cool. The whole process takes around about 15 to 20 minutes. In the areas where she has some severe acne, we've actually double passed it. Margie will get some swelling over the next 24 to 48 hours. It's very important that following this procedure we cool the skin. And again, what I'm trying to do here is promote collagen repair to lift some of these very, very, very deep acne scars. You okay, Margie?
Yeah.
How do you feel, Margie? Do you feel a little warm?
Yeah, sheets are warm.
Yeah. Okay, let's just have a little look. And again, if you look at the patient's face, you can see she's got this white. This area is basically where we've abraded the skin. You can see here she's got what we typically call these ice pick scars. And so what I'm going to do is I'm going to go back over this area to lift and try and produce some more collagen in this area. You okay, Marvin? Cool, cool, cool. Okay, Marvin, back on the other side. Okay, so the procedure is complete. What we're now going to do with Margie is we're just going to cool the area. The biggest problem that you have, or part of discomfort of any laser treatment, is the heat that generates in the skin following any laser procedure. What she'll expect over the next few days is peeling, some swelling and some redness. What we'll try and do is we'll get Margie to come in and see us over the next 72 hours, and again we'll video that so you can actually see the whole patient journey. How does it feel, Margie?
Very hot.
Very, very hot, and it probably feels quite tight.
Yeah.
Very, very, very tight. Again, the procedure is good if you can anaesthetise the area. What I will do here is you'll see me remove this, and effectively the top part of the skin as well. So again, if we go along here, I'll be able to show you. Sometimes you can get a little bit of bleeding. You can see here how we started to remove some dead skin, which is here. How do you feel, Margie?
Fine.
A little bit tight.
Yeah, just quite hot.
How hot? Scale of 1 to 10.
6.
Okay, you're being nice to us. Again, in clients that suffer from acne, you tend to get some very, very deep scarring and a much thicker skin. So, again, the energy that we utilise needs to be more powerful. You can see this, you can see the skin removed here. Okay, very, very, very important, Margie, as well, that you keep the area moist. I'll give you some of these gauzes, and I want you to make sure that however tender it is, you just remove those top layers. If we look very, very, very closely, you can see little areas of spot bleeding. That's, again, normal. You okay, Margie?
Mm-hmm.
And then, Margie, what we'll do is we're going to leave you to sit probably for the next 10-15 minutes here. I'm going to put a very, very simple sort of protective sunblock over the top. We'll give you some post-operative creams to use just for today, yeah? Mm-hmm. And no doubt you'll go into hiding for the rest of the day, Margie. Okay?
Mm-hmm.
Right, how do you feel?
Really, really hot and my face is tingling. It feels
Yeah.
quite raw, and obviously my face is really numb.
Yeah, okay, and if we look, we can see how red Margie actually looks. Again, procedure was carried out around about 15 minutes ago. It will feel warm. After any laser treatment, you tend to get what we call a thermal surge. That means that basically the epidermis and the skin heats up, yeah, and then it will cool back down. We're going to give you some water to drink, and we're going to keep you in the clinic for the next 30 minutes, and then we'll let you go home. Obviously today I've applied an ointment over the top. That's a protective ointment. It's extremely important that you don't let this dry out, so to speak. And then we'll see you tomorrow, Margie.
Mm-hmm.
All right, do you feel okay?
Yeah.
All right, thank you. So, good morning, Margie. It's day
2.
Okay, how do you feel?
Really good. Yesterday, after the laser treatment on Tuesday, my skin was really tight and really dry yesterday. It was quite sore to touch. But today is a new day, and it's really good. It's still quite dry and it's still quite red.
You're a little bit red, aren't you? Okay.
Yeah, it's still red.
Pop onto my bed, Margie, and let me just see, because the light's a little bit better there. Okay, so if you have a little look at Margie's skin, you can see she's a little bit red in areas. Swelling's not too bad. Which area is probably the tenderest?
Probably around the cheek areas.
Okay, and what have people said to you?
Nothing too bad, just that yesterday I looked quite bad. I looked really red and got a little bit swollen, but today's a lot better, and just looks like a bad sunburn.
Okay, so you're going to go ahead with it again?
Yeah, definitely. Yeah.
Okay, so what I'll probably do, Margie, I'll see you again. This is absolutely normal. It would be used in cases of acne, in cases of anti-aging, so you get a nice tightening effect. Very, very important that you continue with the creams that I've given you. You keep a very, very good sunblock on as well. I'll see you on Monday, so your fans, yeah, can see where you're up to with your treatment. And again, this is what you would normally expect as we start to resurface. Your outbreaks are definitely better, yeah. And thank you very much. So when are you back at work?
Monday.
Okay, that's fine. And again, you can put a little bit of mineral makeup over the top of that now. Should be absolutely fine.
Okay.